All right, well, I thought this would be an exercise that, frankly, I thought we should do it for ourselves first, so we understand what we're doing, each of us. I had a partner once, we were trying to do a project on international telemedicine. I told her that it's going to look really great. Because what I was reading from my cortex in my brain, and she couldn't see it, and I have never told her what I was thinking. So I thought this would be a really good idea for us to say what we're thinking and what we're looking for in the next few years as far as the healthcare is concerned. So let me start. I thought we should call it transformation event. And just a couple of seconds ago, I wrote on this book, in which I write a lot of things on it. Hopefully one day I'll write a book on that. I'm going to call it Life Beyond COVID-19. Because until now, we were just really concentrating mostly on how to survive from COVID and do basic healthcare issues. And this has been a case for around the world. How do we do this? I think we have a couple of elements that we think this will be the most appropriate. Let me just see something, because I don't think so. I have the right presentation here. So we have some really, let me start with great news, right? Because I think we all need good news. Enough of this death from COVID or with COVID. Yesterday has been an awesome day in the healthcare of Kosovë. We started with the first operations, the first patient to be taken care of the pediatric hospital that was built by and financed by United Arab Emirates. So my thanks to them. And congratulations to everyone who was involved. I put a couple of pictures of our group on Saturday when we visited at the bottom of the both sides of the picture. Just to say that even on Saturdays and Sundays, the team worked really, really hard. I almost felt bad for having my picture on it because I didn't do much with this except pushing the whole project a little bit more in the last few weeks. So congratulations to everyone. And this has been a huge gift, probably the best possible gift for Kosovë kids. So thanks to everyone, and particularly thanks to UAE. So I've been thinking about this quite a bit. What we need to do to transform healthcare in Kosovë? So I put in the upper part of the picture of the slide interventions that we need to have, and some of them are in the process. This is legislation. I have a list of huge list of legislation acts that we are working on it, including healthcare law and others. In all, there are actually 16. In all, there are 21 laws and regulations that we are working on it. But simultaneously, in order to have a good healthcare system, you have to have well-being healthcare workers who are really taken care of. So we need to work on it. None of this can be done without your partnership and friendship, particularly support. So international collaboration and support will be key. And we need to move into accrediting all our processes, and I'll go into a little bit more details as far as the healthcare, what programs we need to really credit. We need to improve the infrastructure. I saw many studies. I read a number of those studies that have been done over the last few years, 2015, 16, 18, and then 19 and 20 and so on and so forth. And each of them, every assessment said the same things. You need to do this, you need to improve infection rate, you need to improve quality, but unfortunately, I don't think so we have done much on that regard. So we do have very good guidelines. We have a very good roadmap. We just need to do it. So improvement on infrastructure, no question, it's one of the key interventions. But we have room to improve ourselves too. We have to improve management and our self-dedication as well as collective dedications. Healthcare system of Kosovo belongs to everyone who lives and works in here. So this is why we need. Obviously, in the center of the screen, I put our motto, which is patient-centered, data-based, research-oriented, and technology-driven. Is really the engine beyond everything that we're going to do in healthcare in Kosovo. And this will prove some results. I'm pretty sure that if we do what it is in the upper portion of the slide, will produce a result which means increased human capacities and expertise.
Indicator that I keep referring to, because for me it gives us a sense of urgency of acting in human development and particularly health, and that is the human capital index for this country, which stands at 57%. What is it? The human capital index is basically the chances that a child that is born today has to basically take full advantage of the opportunities provided by the health and education system of a country to contribute to the country's development. And in the case of Kosovo, it stands at 57%. That means that a child that is born today has 57% chances to be to contribute positively to the country's competitiveness, compared to the chances that the same child would have had the health and education system, social protection system of that country being fully functional. When we look at the health sector, there are some challenges that we all know and we are aware of. And when I first joined the office that I'm managing, we were in the midst of the pandemic. And so the donor coordination exercise was a donor coordination exercise that was mostly and essentially skewed towards responding to the pandemic. And I remember in some of the meetings that we had with the administration, with the other development agencies, we were always talking about, yes, but we should not forget to look at the long-term development objectives that we all have. But it was impossible at that time. Long-term objective was basically to be able to survive, coincided with the short-term objective of surviving the pandemic. And, but I'm glad to see that thanks to the efforts that have been put into addressing the pandemic, vaccinating people, convincing people that vaccinating is actually the right thing to do, that we are in a situation now where we can resume the discussion and the thinking on health and health development challenges. I would like to conclude that, yes, we at the World Bank, we have been working, we have been taking the baton from the Luxembourg Cooperation Agency, and we've been working together with the UN agencies to lead the donor coordination effort. But this exercise, we always thought and believed that this exercise would come to an end, and would come to an end once the authorities were ready to take the baton from us and move forward and carry this dialogue based on their own strategy. We are all here as partners. We're not here to have a conversation, at least that is my strong belief, that we're not here to have this conversation, we and you. We are all together in this conversation. We are all together in this journey.
The state of developmental monitoring and early detection intervention for children with disabilities would suggest that there are issues also in primary, and so I'm wondering how that fits in to this.
Actually, I am very honored being here and hearing your agenda, which is quite comprehensive, and it is what we really needed to hear from our government. Presenting 7 pillars of transformation principles of healthcare, I fully agree with all of them. Starting from digitalization of health system up to advancing the training programs. What I would like here to add is focusing on public health programs, since there are the data and there are health intelligence and staff who are following all the events happens in Kosovo on a daily basis, including hours, which mean 24 hours 7. I spent a lot of time with the Deputy Minister, Dr. Geja, on transformation of public health programs and trying to be in line with the public health programs all over the world, and hopefully we will be in since especially after your presentation now. One of the issues that it is very important that we have to focus, it is universal health coverage oriented of primary health care, which is a preventive program.
Sipas moshës, shumica e njerëzve mes moshës së 40 shumë shpejt, përpara se përqendrohen dhe këto janë ato.
Now you can ask me room at the University Clinical Center. It's 560 square wound care patients. They're not vascular surgery bona fide. Most people do not call it anymore breast center. They call it breast oncology. So we need to add to that. So we need to adopt that process. And so because of it, we don't have enough.
In our society, and maybe just information medicine centers on addressing gender-based violence, including